Hello class, welcome to mental health. Today in mental health, we are going to look at common mental disorders. A mental illness is a health condition that involves changes in thinking, emotion, or behavior that leads to distress or problems functioning in social, work, or family activities. So mental illness, which is also known as mental disorder, this is a condition. A condition is a state of being, a state at which someone is. That is a condition. So this condition involves changes in thinking. The way a normal person thinks, that's not how a mental patient is going to be thinking. There is going to be a difference because there's going to be some changes. And also in the emotional part, most of the times mental patients tend to be aggressive emotionally. They are aggressive, that's why it's difficult to control them. If they are not aggressive, they are so much isolative. They desire not to talk to people, but just to be on their own. And also the behavior pattern is not well identifiable. It leads to distress. Distress meaning that it leads a person to a kind of life that is tiresome, because you find someone can be working, a mental patient can be working from possibly from 01 until 22 hours. All day a mental patient can be working, which is so much stressful and is something that you cannot even imagine, because usually mental health patients they give a lot of functional problems. In the way they do things is not useful. It becomes so much unuseful to the people around. Both socially, they cannot socialize well. They cannot work. If it's to work, they'll work, but there is a gap which is going to be there between them and someone who is doing things normally. Their work is done with so much compromise. And most, they are not able to perform family activities. If it is a father, is not able to work and feed the family. If it is a mother, she is not able to work and be able to give a parental guidance to the family. Mostly you find a mental health patient staying away from the family, just moving about in the community. In terms of psychiatric services, there are close to 560 beds for psychiatric patients across the country here in Zambia. So in Zambia, we're able to admit 560 patients, both in Ndola, Lusaka, and any other part where there is a mental healthy or rather a psychiatric hospital. Common mental disorders found in Zambia are acute psychotic episodes. So this is a type of, I'll use a term, madness that is episodic. This illness comes and goes, which commonly is seasonal. And you hear a lot of people mentioning that no, if the moon is out, then a lot of mental patients will become sick. I don't know, but that is a belief that is there in our African setup. But medically, it is episodic. It is just a season, especially when it is cold and when it is too hot. When it is cold or too hot, remember the brain responds to the weather, which makes them to trigger the psychotic imbalance. Also schizophrenia. I'm sure we talked about schizophrenia some time back, if it is possibly last week. We talked about schizophrenia. And affective disorders, alcohol-related problems. A lot of people that we admit in our hospitals relating to mental health, you'll find that it is alcohol-related problems, such as alcohol withdrawal syndrome. And lastly, organic brain syndrome. These are the types of mental problems that we encounter here in Zambia. So types of mental illness. There is depression. Depression is one of the type of mental illness. If someone has been disappointed, they tend to become depressed. Anxiety disorders. Anxiety, that is generalized disorder, which involves a social anxiety disorder. So it could be general or it could be a social anxiety disorder. To be anxious of things, to so much desire to do something. You know, we all desire to achieve something, but there is an over desiring of doing things. It's normal to have fear, but the over fear of things, even the unknown things. That's what anxiety is all about. Then there is also bipolar disorder. Bipolar disorder, remember we talked about dopamine. When dopamine is highly increased, that is called bipolar, meaning there is so much increase of dopamine secretion in the mesolimbic, which is a part of the brain where dopamine is secreted. So this results into stress and so forth, like we talked about last time. Obsessive compulsive disorder. So these people who have obsessive, this is when you hear something like compulsive, meaning it comes, eventually it comes. Most of them, they react as if they are demonic possessed. Most of them, they behave as if they are demonic possessed and so forth. So you would think they are demonic possessed. Initially, it is just that it has triggered in their brain that they should behave in a certain kind. And also post-traumatic stress disorder. When you go through a stressful moment, after that stressful moment, you just come to believe to be in your own world. A lot of people have undergone disappointment. They tend to believe that, okay, since that man disappointed me, so all men are liars. They'll believe like that, and they will prefer being alone, not to date anyone. While they are aging, the age of marriage comes, they can't even accept any marriage proposal from any man. They just live in stress, and that is what is called post-traumatic stress. When you lose your beloved ones at a funeral, you cry, no, mom, dad, my hero, my whatever. After that, you become stressed and you're not able to accept. So stress mostly comes as a result of denial. You cannot accept the situation, then you become stressed, and that is what is called post-traumatic disorder. Eating disorders. Eating is okay, but there are some habits. Too much of eating is a problem. which is also known as anorexia. Anorexia nervosa, bulimia nervosa. So some people eat too less food. Some people eat a lot of food. So those are disorders. It's either you have an eating disorder of taking too less food, or there is a eating disorder of taking too much food. Initially, a normal person should take food that is according to their stomach size. Attention deficit. There are people who are not able to pay attention to things. Even in class, you find that they will respond to anything. They will pass silly comments and so on and so forth. They can't pay attention. That is another kind of mental illness. This category also involves the hyperactive disorder. It is normal to be active, but some activeness is beyond the normal. There are some people who are very active. When they are talking, they talk fast. When they are doing things, they do them as if they are dying just immediately now. So in short, it's normal to be active, but you don't have to be hyperactive. You don't have to overdo things. Do them at its normal state. Don't overdo. So when someone is overdoing things, a journey which you can walk in 5 hours, you want to walk it in 1 hour, then there is a problem. There's a problem. And yes, many people who have hyperactive disorders, they manage. That's why I mentioned earlier that a mental patient is able to walk from Lusaka to Chongwe by foot. That's being hyperactive. Borderline personality disorder. There are people who do not have a specific identification. When you go at people or people who go to church, you also become one of the church member, or you become a papa or whatever. When you interact with junkies, you also look to be one. When you interact with a police, you also look to be a police. When you interact with a boxer, you also look to be a boxer. Meaning you have a borderline personality disorder. So someone should be identifiable. Who are you? No matter the group you are with, you should be identifiable, because you should have your own specific personality. There's nothing like when you go to Rome, do what Romans do. No, that is one kind of people who promote borderline personalities. Because if you are not a Roman, you can't do what Romans do. How are you going to speak the language of Romans? It is not possible. So when you go to Rome and you pretend to be a Roman, just know you are a mental patient. Substance use disorders, such as alcohol use disorder, drug addiction, and substance abuse. So substance abuse and the drugs also lead to a mental illness, because the behavior of a person who abuses drugs and substances is it involves the brain, and it disturbs the normal function of the brain. So when we talk about substance, even a drink is a substance. Too much of taking Coke, too much of taking Mirinda, it is a mental problem. It's a mental illness, because you become addictive. Any addiction is a problem. Some people are addicted to water. Some people are addicted to Coca-Cola. Some people are addicted to different substances. So whenever there is an addiction, just know that it is a mental illness, because addiction is part of mental illnesses. So there we talked about illnesses. Here we are talking about types of mental disorders. A illness is a sickness. A disorder is something that is difficult somehow to let's say like to, okay, a disorder is an imbalance. It's an imbalance. Something is not balancing somewhere. So a lot of people live with disorders because when there is an illness, you will know to say, okay, this one is sick, and you can treat. But a disorder you cannot treat, you can only control, either by talking to the person and so forth. Because it is just a disorder, it just needs to be corrected. So, for example, one of the disorders is anxiety. Anxiety, like I mentioned earlier, some people have so much anxiety, they have so much fear of the unknown. Eating disorder. Eating is also a disorder which one can control. A mood. A mood is also a disorder which one person can control. And with your help, by providing psychotherapy, then you're able to control these disorders. Trauma and stress are related. Trauma, it's a painful moment. Stressor, it is something that makes you oppressed, a situation that makes you to overthink. That's a stressor, because when you overthink, you stress your mind, and at last you feel sick. You can feel as if you have malaria. Meanwhile, it is just your mind which is too occupied with certain difficult moments. Maybe your boyfriend shouts at you all the time, or your girlfriend looks as if she's dating one of the people you are scared of, or you are suspecting your relationship is not in order, then it will be stressing you because you need to think about. Education is one of the stressors, because any student should study and pass. Equally, I expect all of you to study and pass. I don't expect anyone to fail, because this course you are doing is not an easy course. It's one of the most difficult programs. When you get your diploma, someone will ask, which program did you do? I did mental health and the clinical counseling. They will be like, that's why we have few mental professions. Why? Because people are scared of mental health. Today you will see it simple when you are doing theory, but when it comes to practical, you will definitely see how tough it is. But I know with you, it will be okay. Also, personality. Your personality is something that you can change, because you can choose a specific personality that you need to have. You can choose, and there are some personalities that otherwise they lead us into mental disorders. We try to classify ourselves the way we are not. You are a Zambian footballer, you only love Messi or Cristiano Ronaldo, and you want to play like Messi and Cristiano Ronaldo, which is not possible, because you are not Messi, you are not Cristiano Ronaldo. So when you try to switch your personality to be like someone, you start playing football like that person, just know that your personality will be disturbed. You can only copy some styles, but don't act to be like that person. Also, psychotic. Psychotic, this is what mostly we refer to as madness, because this one is mostly genetic. You are able to get it from parents to parents, to children. That is mostly which we call, no, that is madness, because in psychotic there is behavioral problem. There's behavioral problem. This is just another illustration of types of mental health, like in terms of diagram. So when you look at this diagram, it is showing us where our mental illnesses comes from. We have a generalized anxiety disorder, which comes from the center of the brain, which comes from the center of the brain. You can see on the yellow part, we have post-traumatic stress disorders. On the yellow part, that is where the occipital area is. So on the occipital area, mostly that's where most of the head injuries occur. Because when you fall, you will not fall backward, you will fall backward. I mean, you will not fall front, you will fall backward. And you hit yourself on the occipital area. And that is where mostly the disorder starts from. On the cerebellum helps us in thinking, in cognitive. And that's where phobia comes from. Phobia, it means fear, to fear things. When you have fear, or when you develop fear, it's a mental problem because it involves the mind, and whatever the mind believes, you definitely cannot challenge your mind. That is also where obsessive compulsive disorders is coming from, because that area deals with memory. So if your memory is not okay, it is triggering, then definitely you will have obsessive compulsive disorder. In your frontal part of the brain, you have panic conditions, because the frontal is where logic is. Logic is what helps us to think faster. So you will have panic because you want to think faster. You want things to be done on time. Suppose you are given a task like an exam, and time is allocated to you that within 2 hours or 3 hours you should finish your exam. You will panic so that within that time you should finish. But there are people who are always at panic. They are never at easy, meaning they have a problem in their frontal part of the brain. Interventions. So what interventions are we supposed to give to these patients? So interventions are into two categories. We have what is called rehabilitational intervention. Rehabilitation, this involves the psychotherapy. Psychotherapy is the counseling that you counselors provide to people. That is psychotherapy. You provide counseling and you also provide guidance. Secondly, it's detoxification. Detoxification, remember, people who have abused substances, they need detoxification. They need a drug specifically which will help to reduce the level of substance in their body or blood. Also family reintegration. If a person have mental illness, they dissociate themselves from the rest of the family. But this one, or under rehabilitation, it is us to reunite that person with the family. The family should know to say, oh, our brother, our sister, our mother, our relative has a mental problem, and they should be able to keep them at home, because these patients are not admitted forever. No, they'll just be admitted for a short time of, for a short period of time, and be discharged home. Because if they keep them long in the ward, they can also acquire other diseases, and possibly they can have what is called hospitalization mental illness, which results because of the environment where they are. Hospitalization mental illness or condition is that one which people say that most of mental doctors, psychologists, mental health practitioners like you have like an element of madness in them. It is not because they are mad. No, it is the environment where they are. Because for you to cooperate with someone who has a mental disorder, you have to act similar, not exactly like them, but you have to cooperate with them. By cooperating with them, in short, people will identify you to be like one of them. So even when a patient has been admitted longly in the mental hospital, they tend to trying to live like the others how they are living, and that is what is called the hospitalization mental disorder. So here in Zambia we have places. The place is Chainama Mental Hills Hospital or Chainama Hill Mental Hospital and other registered rehabilitation homes. When you finish this course, you can also open your own rehabilitation center where people will be coming. You counsel them, you provide rehabilitation, and you are paid a lot of money because mental health is one of the high paid program. The second one is forensic response. So forensic simply means investigations. It simply means investigation. So this involves the isolation. There are patients who are violent. They beat, they are able to kill someone and so forth. So these people are isolated. So when you go to Chainama, Chainama has 2 hospitals in it. There is a general mental health hospital for rehabilitation. And there is also a forensic hospital. This is where they put those mental patients who killed someone or who once had beaten someone. Even those people who are in prison because of fear of being sentenced, they tend to pretend to be normal, to be mental patients. They are taken to forensic hospital so that they can be examined properly. So when you are there, you are isolated from the world. It's a prison, in short. When you are in Chainama Forensic Department, it's a prison. Detoxification is given so that the substance abuse present can reduce. Reintegration to family. Definitely, like I said earlier, that patients are not admitted forever. After a certain period of time, they are being discharged home and they have to be reintegrated with their families because their mothers, their fathers, they have children, their brothers and sisters. They need to live with the family. And also the treatment. When you are at forensic, you're also given a medical treatment, just the same as in rehabilitation, so that a specific illness that you have can be combated. It is also serves as a sentence. Like I said earlier, that this is a prison. It is a prison. So when a mental patient kills someone, he or she is charged for murder or manslaughter. They will sentence this person maybe 10 years. So the person will be admitted for 10 years in Chainama Forensics as a sentence, serving the sentence. It's a prison. So this is it about mental disorders and illnesses. Next time, we'll also look at other mental imbalances, such as we need to look at certain behaviors, in short, the behaviors of mental patients. Thank you so much.